The next patient is a young, like he was like 40, whatever, something years old, and he came in with abdominal pain or something like that, and had an ultrasound, and on ultrasound I can't show you ultrasound because I can't de-identify that, but on ultrasound they saw evidence of cirrhosis and some liver lesions, and that's what they did the MRI for liver lesions. Um, and liver lesions in and of themselves were somewhat interesting, but
Yeah.
as I was reading the case, I start noticing this. Uh, oh, sorry. Okay, so my PAX is somewhat gooey today. So you can see that he has ascites, he has cirrhosis, and then you can see that in one of his ribs, you see some sort of callus formation, maybe a little bit of hematoma around it. So
Hmm.
there's evidence of some sort of recent or somewhat recent trauma. And then as I'm reading the case, I found he has ascites, and you see this little kind of blob here that on the first glance maybe it's related to the standing wave artifact. You can see them elsewhere, but this is a little bit more kind of solid. And then as you continue to read case, you can see there's another blob corresponding, and this blob is on T1 pre-contrast. It's kind of intermediate to bright signal intensity. And then as you go through the phases, you can see that the blob kind of changes the shape, and um, and you can see that there's like hyperemia surrounding this kind of rib. So this is just acute finding. This patient basically is an alcoholic, and he denied any trauma, but clearly he had recent trauma, and he had a little bit of bleeding from his liver capsule. So that completely unsuspected, completely not unrelated to what he came in, and it's just a reminder to have an open mind because sometimes we see things that don't, not suspected clinically. And here we go, right there. And then the patient
Did
had
you know
follow-up.
he had trauma, like
No,
prospectively?
he adamantly denied. However,
Huh.
as here we go. This is a follow-up. You can see a little clot there. Um, but once they probed further, it turns out that a day or two before, so this was done on the day after Christmas. So at the Christmas party, he was really, really drunk and tumbled down the stairs. But he didn't remember that. So at the time when I suggested that there is a fracture and the bleeding, there's like, no, 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 there's no trauma, there's no trauma. But then once they probed, I think even maybe his family, they figured out that he did actually have trauma. But he was stable. They didn't have to do anything. So that was
Strong
just
work.
cute, huh?
Strong work.
That was just cute finding.
This reminds me of a case I had in residency, and it was a case from the ER. He had right upper quadrant pain, and I saw what I thought was a giant hemangioma in the liver, and then like an adrenal nodule. And I was like, okay, giant hemangioma, adrenal nodule, and the clue was that there was an overlying rib fracture, and it was actually a huge hepatic laceration, and the adrenal gland was a adrenal hemorrhage. And
Wow.
I guess that's a classic pattern. So like basically the liver and the adrenal gland get squished between the spinal, the vertebral body and the rib. And so if you see all of those three things in a line, don't call it a hemangioma.
So I had a one of my attendings from one of a resident. He had a internal sign for him. If he saw a patient with cirrhosis and posterior rib fractures, alcoholic, because that's exactly what they do. They black out. They don't remember having trauma, and they have these rib fractures from falling down completely drunk.